Hi guys, today's topic about Aphthous ulceration, or you can say Aphthous ulcer or Aphthous stomatitis. So these ulcers are mainly genetically susceptible plus environmental factors induce. It is 100% cases having genetical susceptibility. In out of these 100%, some patient may present with Aphthous ulcerations, some may not present. They may have subclinical Aphthous ulceration. So, this Aphthous ulceration having genetically susceptibility. So, what are the environmental factor which causes this Aphthous ulceration? Mainly two factors are main important. One is hematinic factors. Another is SLS factors. It means what is SLS? Sodium lauryl sulfate. Sodium lauryl sulfate containing substances. These two factors induce this plus genetic susceptibility having role in formation of Aphthous ulcer. What is hematinic? Main important is folic acid, serum ferritin in the blood, and B12. These three are very important for the Aphthous ulcer formation. Sometimes if there is normal CBC, even though these are deficiencies, it means these factors should be ruled out in the blood investigation. So if you correct these, Aphthous ulceration will not occur most of the cases. What is sodium lauryl sulfate containing agents like toothpaste, chocolates, and benzoate containing this food uh, items and substances. So this sodium lauryl sulfate and folic acid ferritin B12 deficiency with genetic factor may induce this Aphthous ulceration formation. So what are the Aphthous ulcers? These are the three types. First is herpetiform. Second is minor, and third one is major. Herpetiform ulcerations are very minute, most of the time less than 5 mm. They may have number more than 100, and these are mainly on the keratinized mucosa, mostly posterior part of the oral cavity, keratinized mucosa, and they heal within 2 weeks without any scarring. Sometimes they coalesce and form the major ulceration. Seems like major ulceration, but this heals spontaneously within 2 weeks if you correct the environmental factor. Minor ulceration are less than 10 mm in size, maybe up to number 10. They may be up to 10, and they are mainly on non-keratinized mucosa. It means entirely in the oral cavity. They heal within 3 weeks and without most of the time without scarring. Major abscess ulceration mainly more than 10 mm in size, and most of the time one ulcer is only there in the, and they may occur on both non-keratinized and keratinized mucosa. They may occur anterior and posterior part of the oral cavity, and they heal within 3 months. May heal with scarring or without scarring. So these are the different type of aphthous ulceration. How they form? This is aphthous ulcer is immunological. Immunological complex mediated disease by the T cells. So these T cells lead the damage of epithelium of basal membrane of the oral cavity. So T cell leading epithelial damage which lead to different type of the ulcer formation. Now, what is the treatment? So these ulcers are recurrent ulceration. Most of the time they are having history of family, and these are recurrent ulceration. Treatment mainly symptomatic and cause the underlying factor. Like if you do ferritin, correct the ferritin level, correct the B12 deficiency, correct the folic acid deficiency, and avoid substances like toothpaste, chocolates, which contain the FLS. This sodium lauryl sulfate induces the formation of recurrent ulceration in the genetically proven disease patients. So these genetic patients, you have to correct these factors and symptomatic treatment like benzodiazepine lotions, and if severe, give steroids and immunomodulator like azathioprine, steroids, azathioprine, methotrexate. These are the medication. You can give topical steroid as well as systemic depending on the severity of the aphthous ulceration. And another important thing you can do, you can have 100 milligram doxycycline tablet in 100 or 200 ml water. Mix it with the water and rinse it in the oral cavity. You do gargles. Why this? So this is also effective. So this is main important factor is this environmental for genetic susceptibility. What important point here is a patient come to you multiple times. You just note down these patients have to give this topical or systemic therapy prior to ulcer feeling. Means if before ulcer appearing you give this solution or therapy, then it is very effective. It means recurrent ulceration. First time you will not come to know that this patient will develop aphthous ulceration. But second time you note on the file that patient if having symptom of developing oral ulcer like pain or itching or burning sensation, then tell him you start these treatment immediately so that ulcer will be cured before appearing. So this is all about aphthous ulceration.